to introduce our speakers for the final session of the Patient, Family, and Donor Research Forum. So I'd like you all to please welcome Carrie Thibodeau and Tamara Beardy. Carrie is the National Director of Programs and Public Policy at the Kidney Foundation of Canada. In this role, she leads national initiatives that support people affected by kidney disease and drive strategic advocacy to achieve meaningful policy change. An accomplished leader with over 20 years of experience in the healthcare sector, she brings deep expertise in evidence-based policy development alongside a strong foundation in patient support and health communications. Carrie's work is grounded in a collaborative approach shaped by her experience partnering with a broad range of stakeholders across the country, including patients, clinicians, and researchers. Her career focus on kidney health was inspired by her family's lived experience, and she is committed to expanding access to treatment and education for all Canadians affected by kidney disease. Tamara Beardy is an Indigenous health advocate and community leader originally from Tasquewaia Cree Nation, located in northern Manitoba. She is widely recognized for her work raising awareness about diabetes and kidney disease, particularly within First Nations communities, and for her personal storytelling and leadership in health education and research. Tamara has worked with national and provincial initiatives promoting patient-oriented health research and Indigenous engagement. She is a member of the Indigenous Peoples Engagement and Research Council and has participated in anti-racism healthcare training and research networks. She also shares her own lived experience as a living kidney donor since 2009. With that, Carrie and Tamara, I am very pleased to pass it off to you.
Thanks very much. Good afternoon, everyone. Thanks for the opportunity to speak today about the development of the National Strategic Framework for Chronic Kidney Disease, and specifically how we engaged Indigenous partners throughout the work that we've done over the last several years. I'm just going to share some slides. Bear with me, my computer is just thinking.
Absolutely, yeah.
Oh, it says I don't have rights to share slides.
Oh no, well, could we perhaps have the CDTRP team give Carrie?
Yeah, MC will share rights in a second here.
Thank you very much.
Could you try again?
Okay, you should be good.
Yeah.
Go, Carrie.
I can try again. No, it's still saying no. Is it possible for the CDTRP team to share the slides?
Yeah, we can share the slides on your behalf. And it might just take a quick moment, but MC, whenever you're ready.
Terrific. So I'm not seeing Tamara yet in the list of participants, so hopefully she'll be able to join in a few minutes. But yeah, I'm pleased to take everybody through all of the work that we've done over the last 3 years in developing the framework.
We're very excited to hear all about it. So eagerly.
Apologies for the delay, everyone.
Not at all. It's always tricky to navigate these large Zoom meetings. So many little details to figure out.
Carrie, it's Sandra Holsworth. I just wanted to say hi. It's good to see you again working.
Hi, Sandra.
You're doing great work.
Thank you. Okay, I see the slides. Let me just minimize. Okay. All right, if we can go to the second slide, that would be great. Yeah. So over the next few minutes, I'll share why an equity-focused approach to kidney health is essential, how we engaged Indigenous partners throughout the framework development process, and then what we learned from those conversations and how those insights really influenced the final framework. And then hopefully we'll get to hear from Tamara, who is one of our patient partners on this journey. And then finally, I'll just conclude with a description of our commitment to future engagements and partnership as we're moving forward. Okay, slide number 3, great, thanks. Okay, so when we look at kidney health in Canada, it's very clear that First Nations, Métis, and Inuit peoples do experience a disproportionate burden of chronic kidney disease. Indigenous peoples are nearly 3 times more likely to develop kidney disease, and they do face higher rates of some of the risk factors for kidney disease, including type 2 diabetes and hypertension. So many individuals experience kidney disease at younger ages, which is another important factor to be considering. And they encounter significant barriers to accessing dialysis, transplantation, specialist care as well. And these challenges are, of course, further compounded by system inequities, geographic isolation, historical and ongoing experiences with the healthcare system. And all of this directly affects health outcomes and quality of life. And because of these realities, equity wasn't an optional consideration in developing the framework. It was absolutely essential. Next slide, please. Okay. So just a brief minute to describe the framework itself. So the National Strategic Framework for CKD really is intended to serve as a roadmap for coordinated action across Canada. And by that, I'm speaking about not just the federal government, but also provincial and territorial governments. Its guiding principles, which you can see here on the screen, were developed very early on in collaboration with the kidney community. If I can get just one more click, that would be great. Thank you. So at its core, the framework focuses on prevention and earlier detection, improved outcomes, and equitable access to care. So importantly, it does recognize that achieving better outcomes in kidney disease requires addressing the unique needs and the experiences of different populations, and that includes Indigenous communities. Next slide. Great. So just talking about how we engaged Indigenous partners throughout this process. From the very beginning of the framework development, we wanted Indigenous voices to be included in a meaningful and authentic way. So Indigenous partners participated on our patient caregiver and donor advisory committee. They contributed perspectives through dedicated focus groups throughout the process, and that included people with lived experience, but also Indigenous allied health professionals who are working in Indigenous communities. They also took part in our broader stakeholder consultations, and we did have a national survey as well of people who are affected by kidney disease, including caregivers and donors. We made specific efforts to reach northern and remote communities, and that included some targeted outreach around the survey in the Northwest Territories, in Nunavut, and in the Yukon. And we also ensured that Indigenous voices were represented throughout the advocacy activities that we've taken part in and all of the discussions with policymakers. So Indigenous voices were always a part of those meetings and the outreach that we were doing, because the goal was not simply consultation. It was about creating opportunities for Indigenous perspectives to inform every stage of the framework's development from A to Z. Next slide, please. Okay, this is, one of the slides is still hidden. Okay, overall, just before I get into this, I'll say that overall what we learned across all of our engagement activities, there were several key themes that consistently were emerging. Our partners really, to start with, emphasize the need for culturally safe and appropriate care. And this really highlighted the importance of distinction-based approaches, which we've heard about earlier today and throughout the meeting, that really recognize the unique experiences of First Nations, Métis, and Inuit peoples. And that really includes a recognition that language plays a key role in building connections and relationships and trust. We heard about the impact of food insecurity, geography. We heard about barriers to healthcare access. And participants throughout the process really stressed the importance of Indigenous leadership and community-driven solutions. And then finally, many did speak about the ongoing effects of systemic racism and historical harms, and the need really to build trust within healthcare systems, within relationships. And all of those themes became foundational considerations throughout the development of the framework. And so this slide that we're looking at here, and I'm going to do this for each one of those themes that I just kind of briefly went over. These quotes come directly from the focus groups that we held. So either from people with lived experience of kidney disease or people who are allied health professionals working in Indigenous communities. So this first quote was really around the cultural safety aspect. So one of our participants shared, "It touches my heart because it's a difficult journey, and it's unfortunate that we still have to continuously tell these stories over and over again." And this quote really reflects the emotional burden that many Indigenous people carry when navigating healthcare systems. This was very clearly expressed to us throughout this process. Participants spoke about the importance of culturally safe and appropriate and relevant care in environments where people are feeling respected and heard and understood. They emphasize that trust and relationship building are critical components of healthcare. Next slide, please. Okay, and this is about the distinction-based approaches. One of our participants emphasized that Indigenous communities, of course, are not a single group. And we heard this throughout the focus groups, but this particular quote, as they said, you know, all of our experiences are different and unique to us. So we heard continuously that solutions really must recognize the distinct identities, the cultures, the languages, the priorities of First Nations, Métis, and Inuit peoples. And they emphasize that Indigenous engagement should be intentional. It should be inclusive, and it should be distinction-based right at the outset. Next slide, please. Okay, and so this quote is really around community-based solutions. So a strong message that we heard from the healthcare professionals we spoke with was the need to build capacity within the communities themselves. One participant asked, how do we support and build that capacity at the community level where it's going to stay? Rather than relying solely on external resources, participants really encouraged investments in and a commitment to local leadership, local expertise, and community-driven approaches that can be sustained over the long term. Next slide, please. Okay, around food insecurity and access, participants in our groups highlighted really the realities that many people are facing, particularly in remote and northern communities. As one person noted, you can see here, you can't tell people to go and eat green vegetables when a head of lettuce is $10 to $15. And this really speaks to the difficulty in focusing on prevention when people aren't in a situation to really do the things that that would maintain their kidney health. So this powerful example here reminds us that healthcare advice should be grounded in people's lived realities. So geography, transportation, food costs, access to services, all of these influence health outcomes, and they need to be considered when we're designing kidney health strategies. Okay, and next slide, please. And then systemic racism and historical harms. So we heard directly about the impact of systemic racism and inequitable healthcare systems. Participants in the focus groups talked about how the gaps in services and systems and resources and culturally appropriate care really contribute to poorer outcomes and mistrust. These conversations reinforce that improving kidney health requires not only clinical solutions, but we also have to address the broader systemic barriers and create healthcare environments that are equitable and that are respectful. Next slide. All right, so all of this feedback that we received had a direct impact on the final framework. Equity and holistic care, as you saw in an earlier slide, really became foundational principles throughout the document. The framework includes a stronger focus on rural, remote, and Indigenous communities, and it places more emphasis on community-led solutions. It recognizes the importance of a holistic approach to health, culturally safe models of care, and the value of Indigenous ways of knowing and healing practices and incorporating those and prioritizing those. And these weren't additions that were made at the end of the process. They were integrated throughout the framework development and the framework itself because of what Indigenous partners shared with us. At this stage, I would normally have passed the mic to Tamara. And I don't know, can somebody confirm whether she was able to log in?
We do see her in the guest list, but she might be having trouble connecting or having internet issues. Oh, hello, Tamara. There she is.
All right. So I'm going to pass the mic to Tamara, who is one of our patient partners. She was and continues to be integral to the advocacy that we've been doing over the last little while. And she was a part of all of a number of meetings that we had in Ottawa at the launch of the framework just in March. Over to you, Tamara.
Hi, good morning. I don't know if you guys can all see me.
Yes, we can.
Can you hear me clearly? I'm in a very it's storming right now in the community that I'm working in. So I apologize ahead of time if there are any disruptions due to weather or connection. And I just wanted to just inform, I think we got mixed up on times. My time here is about 1:21, and we talked that we were going to be on at 2. So, but anyways, I'm here. Good morning. So my name is Tamara Beardy, and I am Indigenous Cree from Tatasqueya Cree Nation, where I'm currently working right now. And but I've resided in Winnipeg for the last 13 years. So and being part of the focus group with Kidney Foundation has been a journey. And I just want to talk about kind of my journey as a kidney donor back in 2009. So there's so many places to start, but where would I'm trying to think where I would start. Back in 2007, I was currently in the nursing program to become a nurse. And 2 years later, my sister was diagnosed with, um, well, she had chronic kidney disease already, but we didn't know or expect the decline in her kidneys to be onsetted earlier. So in 2009, she was sitting at, I believe it was 13% functioning at that time. And then being a nursing student at the time, and knowing that I've always wanted to be the one to help her in kidney donation. So I had made a decision to leave school and focus on becoming the kidney donor at that time. So, um, and fast forward, like just going through the system and the healthcare system and doctor visits and healthcare team that was taking care of my sister. Um, it was a lot. And I, like thinking back now, that was such a time and place to really, for her to have somebody to hold her hand through all of that was so crucial. Because patients in those situations don't fully have their voice, or there's a lot of things that they're scared to ask or to share. And I'm really glad that I was there to help her be her voice and to really highlight some areas and also be supportive in her decisions and her choices. Because a lot of times, doctors and health providers direct you on what you need to do, but at the same time, there are options, right? As patients, you're usually not given all the options that you have. And but I was there to be able to make sure that she was able to know those options and to be able to explore those options, and kidney donation was one of them. She didn't go on dialysis. She refused dialysis for 18 months. And also me being the sister and part of the family, and also, preparation for kidney donation. I got to see the decline in her health and the different levels of, the days of her not being well. Am I still connected?
You are.
Yes,
Okay, I lost a whole bunch of pictures on my screen. I thought I was talking to myself. Okay. Anyways, I know when you have I know I'm on like a time limit here, so I'll try to say as much as I can. It took about 12 weeks to do all testing for donation. It turned out my first test, and we were 6 out of 6 match, and then my last test was checking the function of each kidney, and then finding out that I had 2 ureters coming from my right kidney and one from my left. So I was actually born with 3. So those were miracles that we had witnessed through this whole journey. And now, having the opportunity to, well, there was another thing that happened in my life. My daughter was diagnosed with type 1 diabetes the following year, but that's a whole nother another story. But anyways, kidney donation was scheduled for July 2. I had started testing the end of March, I believe. Yep, and or April. And it was successful donation. And now fast forward, we are here and soon to be celebrating 17 years of post-transplantation. So, and we have marked a map so far, many, many places. Doctors have once told us in clinic rooms that, my sister can't travel she's not well, but I said, no, we're going to the ocean when this transplant happens. And that's exactly what we did. And we have really marked the map and ran a lot of marathons together and just living life. And we're just both so very thankful for our journey and being part of the kidney networks that we're part of today. We are patient partners for the Indigenous Engagement Patient Circle under CanSolve. And also just recently, I was invited with Kidney Foundation to come speak at a government level in Ottawa back in March. And that was such an honorable experience for me being Indigenous, the only Indigenous one sitting at the round table with these delegates, having one-on-one conversation as to why it's important to keep, amplifying the importance of screening, and because of our rates and our numbers in our population is just rising for dialysis patients, and it's just so needed. It's so needed for somebody to keep speaking what the needs are still out there. And then fast forwarding, I'm currently also walking another journey with my cousin who is recently on dialysis looking for a live kidney donor, and he has just started dialysis in January. So it's been a journey for him. Again, now I'm walking right back into the healthcare system. And has things changed since then? So 16 years, there still needs to be a lot of improvements. The most important points are like, it's not just a patient disease, it's family affected. So everyone needs the awareness of the disease and early diagnosis. And the importance of that, the information that is followed through, even the importance of options, and being a kidney donor, a lot of people think donation is scary and it's not safe, but I'm evidence that it's perfectly fine and I'm healthy. So I'm just out here to keep speaking on behalf of, the Indigenous population and also my family members that are facing the disease today, and for making improvements in the healthcare system. Yeah. Yeah. So, and I think that's it for me, unless anybody has any questions. I don't know what kind of time I covered.
You're right on time, Tamara. We have 5 minutes left in our session, so that leaves us with ample time for a couple of questions. But first of all, a huge thank you to you, Tamara, and to you, Carrie, for presenting today. It was so interesting to hear about the setup of this network and so meaningful to hear about your personal journey with transplantation, Tamara. So big thank you to you for your time. I'd like to invite everyone in the audience to share any questions or comments you might have. So you can drop them in the chat. You can raise your hand, turn on your mic and video if you like. And while I'm just waiting for everyone to, sort of get ready and maybe type their questions in the chat, I have a question for the both of you, sort of, if that's all right. So, Carrie, you told us about the development of this network, and Tamara, I know that you were a big partner in developing this network. You were including Indigenous partners, and I'm sure they had different recommendations. You talked about some of the themes that you saw in their feedback, Carrie. Were there any priorities or recommendations which you got which surprised you maybe, or which challenged your original assumptions?
I can go first if Tamara doesn't have any thoughts that she wants to jump in with before me.
Yeah, no, go ahead.
Okay, well, I will say that when we started the process, we did recognize that Indigenous people, of course, experience a disproportionate burden of kidney disease, but our conversations really helped us to understand that improving outcomes really means much more than increasing access to clinical services. So one of the strongest messages we heard is that equity can't be treated as a separate section or consideration within the framework. It needs to be embedded throughout. So that's something that we worked really hard to make sure is reflected in the final report that we released. And one of the things that really challenged some of our assumptions, I think, was the emphasis on addressing the broader realities that shape health outcomes. Because I think on some level we know these things, but we don't necessarily bring them to the forefront and think about them in the same way. But what we learned is that food insecurity, housing and transportation and geography, and language, which is something that Tamara and I talked about in preparing for this presentation, trust in the healthcare system, all of these have just as much impact as medical interventions. So, ultimately, I just think that we were challenged to think beyond traditional healthcare delivery models and how communities can really be empowered.
Absolutely. Thank you so much for that response, Carrie. And Tamara, did you want to jump in with any comments? We do have a hand from someone. I see that Sandra would like to ask a question. So did you have anything to share before we get to Sandra's question?
No, I just always make sure that I share just to know the demographics of our communities and where our dialysis patients come from, like just always putting that in consideration. Again, as Carrie mentioned, transportation, housing, all of that comes into effect. And for people who are maybe, scoping out kind of what care delivery looks like, you're really not going to know until you go into community. So I always encourage people of, the healthcare systems or, the team involvements, to always, visit your communities. And all of our communities also have very different morals and values as to what they do in community and gatherings and language. And even just the education on what they know, the awareness that they know about kidney disease or screening or what that looks like. Oh, I only say that because, like I mentioned in my talk earlier, that I have been just kind of holding my cousin's hand through his journey. And quite honestly, he went from one day being in community in his own room in his house, and then the next day having to be on dialysis in the city, and he never came back home. So just, totally being stripped from his way of living because of treatment, it's really hard. It's really hard on the patients, mentally, spiritually, all around. And those are just some important things that I like to always voice on community level or patient level, because many times they don't speak on those things. But that's why I'm here to speak on behalf of them.
Absolutely. Absolutely. And thank you so much for that response, Tamara. I saw that Sandra had a question, so I'll pass it off to you, Sandra.
More of a statement. So my understanding that this is like a pan-national, so it covers everybody. And then the part that you did, just we're focusing today on the engagement you did with the Indigenous community. What I found very interesting to see is like what we talked about, how this transforms across all levels of healthcare. And I found it really interesting to see Carrie on the first page, holistic, because that's something that as a co-lead of Scene 5 with Chantal, that we're trying to do, because we're more than just our organs and our blood work and that. And also, you know, across Canada, the social determinants of health, like food insecurity, transportation, and even access is all across. So it's interesting to see that all those perspectives were also picked up by our Indigenous people. Obviously, at a higher level, I know I'm doing home dialysis right now as we speak. I heard yesterday that a woman had to travel 2.5 hours to do dialysis, which is, you know, just unacceptable. We need to get more dialysis close to home. I am happy to say here in my community here in Ontario, we have an Indigenous reserve called Christian Island, and they used to have to take a ferry over to Midland to do clinic. And now last year, the nurse who trained me, or the year before, they now have a clinic right on the island. And those are the kind of things that we need to work towards. People should not have to be traveling that way. And the culture safety is there, hopefully their healthcare positions are there, and they can still have access to their community, the foods that they eat, their cultural ceremonies and everything. So I've been following your work, and I can imagine how how exciting it was to go to Ottawa and for all of you to be there. My friend Sean Delaney was there as well. So I just want to say kudos to the amazing work that you're doing, and I look forward to seeing this, and the whole idea about prevention and everything and pre-screening, it all fits into the subjects that we talked about today. So thank you, Miigwech.
Thank you so much, Sandra, for that comment. And I'm just going to read one last comment from someone in our audience before we move on. So Marina has said that on APTN News last night, there was a gathering in Sioux Outlook with patients, local leadership, and Saul Nemakowan, that may or may not be the correct last name, addressing transportation issues from communities where patients miss appointments due to transportation provided by Indigenous Services Canada. So thank you for that comment, Maureen. Certainly does kind of match the concerns that we've heard today in this session, but all throughout our PFD research forum about some of these everyday logistical issues, which are real barriers and challenges to Indigenous communities and patients accessing healthcare. So a huge thank you to you, Tamara and Carrie, for your work and for your presentation. I think you've really highlighted how important it is to have Indigenous partners, not just as patients that we are studying, but to have them engaged in the frameworks that we're making because they have really meaningful and important contributions and experience to contribute to the path that we shape to go forward. So on behalf of the CDTRP Patient, Family, and Donor Research Forum, a huge thank you to both of you for your leadership and your commitment in this space and for your time today. Thank you so much.
Thank you.